introduce you Dr. Sakata, the director of Otsuka Clinic in Tokyo and in all of Japan. Dr. Sakata was the first doctor who started to use hyaluronic acid for the breast, and he published a very interesting article many years ago about a great number of cases of Macrolane. This case report was the first one describing the use of hyaluronic acid. It was an example for all European doctors to start to use hyaluronic acid, and in particular Macrolane, in breast treatment. So Dr. Sakata has now I think the biggest experience in all over the world about this treatment. He published also some interesting books, some interesting book, all in Japanese, about this treatment. And so I introduce you Dr. Sakata. How many cases did you treat?
In this 6 or 7 years, we experienced over 4,000 cases. Yes, yeah.
So an incredible number of cases.
Yeah.
And in your report, you described not so many complications about that.
Yes. Until now, we experienced 4 or 5 cases of infection. And some would say migration. I think 3 or 4 cases of migration, and about that, some lumps. This is the most problem. After injection, we feel some hardness at the injection sites, but pre-operatively we explain the patient about this condition. So usually it's not so a big problem. If the patient complains about that, we can easily solve it. For example, aspiration or some hyaluronic injection. Usually it will be becoming better.
So this
easily.
This complication can be, as in our experience, as in European experience, can be easily resolved by local treatment. We don't need surgical treatment, as some recent peer review articles. So we need only local treatment. And also for dislocation, did you treat
by aspiration?
By aspiration or by hyaluronidasis injection?
Yes.
Thank you very much.
You are welcome. こことこの鼻とこのママね。
Nose and mamma's complications.
Thank you. So these are the article about mammal complication in which you describe this treatment of immigration or of infection. So you had how many cases of infection did you have? 4
I think 4 or 5 cases.
And how did you treat?
Local. No, I'm sorry. Antibiotics from oral or sometimes intravenous, and some small incision by drainages.
So you didn't need to remove the material completely?
No need.
No.
Only
to open and to do
a little bit small incision.
Okay. Perfect. So small incision and local drainage. Perfect. So it was very simple to treat also this major complication. And dislocation, you have all, I've seen in this paper, a small area of the dislocations of Macrolane, so it was simple to do a direct aspiration of this area.
Usually.
Yes, usually.
It's easy.
Or injection of hyaluronidasis was a drug which dissolves Macrolane. Okay. So I think that your experience is very, very interesting for all of us.
Yeah.
And we put your experience on our website or our group of study of macrophylla. So thank you very much.
You're welcome.